Hello viewers, today's write-up is titled Objectification of Patients or Relatives in Ghanaian Healthcare Facilities. I have worked in a hospital for several years, and one key thing I realized is that most Ghanaians present themselves in health facilities like an object to be worked on. Many patients and relatives disconnect mentally and emotionally when they get to health facilities. They lose the ability to convey their opinion and how they feel, even if it is clear the healthcare provider made a mistake or he or she is wrong. This attitude of hospital clients can be likened to a car owner who tows or drives a faulty vehicle to the mechanic to be fixed. After concluding on the terms of repair, the owner gets out of the car and go home while the mechanics work on it. The reality is that the human body being fixed, so to speak, the owner cannot get out of it like the car to sleep comfortably in his or her house and go for it later. All of the human being ought to remain in the hospital while the body is being fixed. Subheading: Danger of patient mechanic attitude. Sickness in the body automatically impacts patients and loved ones' mental state, and so if people cannot freely express opinion while being treated, their recovery process may be severely hampered. When healthcare providers fail to engage clients, they miss the opportunity to identify and address that which eats them up psychologically. Another danger of such detached attitude of patients is that it creates the condition of abuse of patients' rights. I often say here in Ghana, most people are very fearful of healthcare providers in health facilities. There is that sense of being favored on the part of clients, while some staff develop false sense of superiority over clients in their care. But that should never be the case, only if the public are aware of the powerful right they are entitled to when they visit health facilities for care. Nobody knows it all, and mistakes sometimes are inevitable. So if patients and relatives are withdrawn and fear to share their concerns, they end up looking on while wrong treatment is offered and applied. For instance, patient knows 10 milligrams of medicine A is often served. Then sadly, a caregiver came in and served 50 milligrams of that same medicine. The patient or relative saw it and they just allow the wrong dose to be administered. That should never be the case, since patients and relatives form part of the health team. This mechanic and car owner style of relation that largely exists between the Ghanaian healthcare system and the people is unhelpful, and something ought to be done about it. The subtle hostility between the public and healthcare providers, nurses in particular, discourages people from visiting health facilities with health problems early enough to prevent serious complications. This issue is multidimensional and it cannot be blamed on only one party involved. It is a systemic failure. I have written extensively on this problem in my book titled Benaji's Health and Social Diary. I conclude on this write-up by reiterating that you are not a car that can be sent away for repair while the owner goes about his or other duties, and therefore take active interest in your own treatment process when taking ill. This will aid effective and speedy recovery.
Thank you.
Subscribe and follow us.